Our subject for today is COVID-19 and race. The bad, the good, and the very good news. So, the state of New York, and in particular New York City, were essentially ground zero for the COVID-19 pandemic here in the U.S. It's safe to say that New York is further along the road of this pandemic than just about anywhere else in the rest of the country, and consequently there are lessons to be learned. This video concerns recent findings that are coming out of New York City. Here's the bad news. Blacks, Hispanics, and Native Americans, including Alaskan Natives, have rates of infection, hospitalization, and death that are approaching 5 times that of the white community. The good news is that at this time it looks like much of this disparity is probably related to social factors as opposed to some sort of obscure biological issue which might make the COVID-19 virus more lethal to minority communities. Social factors could include things like poverty or crowded living conditions, or maybe just the inability to work from home, which is common with any lower wage workers. And all of those sort of items take time and a lot of will from the society to try to resolve them. But that's still a whole lot better than the alternative of trying to deal with a virus that seems to be just inherently more deadly to black and brown skinned people. But here's the very good news. So both CNN and the New York Times are now reporting that certain predominantly minority neighborhoods in New York City are testing overwhelmingly positive for COVID-19 antibodies. The Corona neighborhood in Queens showed the highest percentage of antibodies, with 68% of the subjects being tested that were showing positive. Subjects in the Jackson Heights community, also in Queens, demonstrated antibodies in 56% of the people that were tested. You compare this to the residents of the Cobble Hill neighborhood, that's another neighborhood there in New York City, which is a primarily white upscale community where only 13% of the people tested were showing antibodies. So why is this very good news? Because these numbers are getting very close to the levels at which a community actually starts to benefit from herd immunity. Herd immunity can be obtained in one of two ways. First, by vaccination of a large percentage of the population, or two, by acquired immunity. That is, people encountering the virus and then recovering from their infection. And so you ask, what percentage of the population needs to be immune in order to begin slowing the actual spread of a virus? Well, estimates vary, but most say somewhere in the neighborhood of 60 to 70% is enough to see a benefit. And we appear to be getting there now in some of these minority communities which were at the forefront of the pandemic and have already been hard hit. Hopefully, these communities will soon begin to see reductions in the number of new cases. White communities, which are demonstrating much lower rates of antibodies in the 13 to 14%, they're going to still have a long ways to go. But the good news is Mother Nature is gradually working this out. Of course, in the meantime, we've got to work hard to protect the ones that are the most at risk, primarily the elderly and those with underlying medical conditions. So, lifestyle modifications such as mask wearing, social distancing, avoiding crowds, etc., may all have some level of protection and some level of benefit for these high-risk individuals. And finally, bear in mind that this whole pandemic has only been with us since March, which it seems like a lot longer, doesn't it? Treatment for the worst of these cases appears to be advancing quite rapidly, actually. We're getting a better idea of what works. Recovery rates are improving significantly. And it's likely that in the next few months we'll see even more advances in treatment and prevention. Until then, I'm going to encourage everyone to stay safe and just know that there is going to be an end to this. We're going to be fine. Doctors, if you like this information, I hope you will hit the like button and subscribe to the channel. I've taken pains to try to make this information digestible for non-professionals as well. And while I'm not really promoting Science in Brief to the general public, please feel free to forward the email and share it with your patients and your friends and your social contacts. They're welcome to follow along if they're interested. Thanks very much. I'm Dr. Mark Payne, and this is Science in Brief.